My name's Jai Francis. I'm a trainee assistant in nursing and I work at Campbelltown Hospital. My dad's Aboriginal, my mum's Australian. My grandfather, he was from Yilnil up in Arnhem Land, and my grandmother was from Ewan. He came down to do whaling and that's how they met and my dad come about. I worked in accounting, just office work for a fair few years, but I really didn't enjoy that, so I didn't know what to do. I tried a few different things. I worked in construction for a bit, drove a forklift for a bit, but nothing really suited me. Didn't really know what to do. I started working at Campbelltown Hospital about 3 months ago. I heard about this opportunity through AES, Aboriginal Employment Services. So I wanted to become an AIM because when I was younger I really wanted to be a doctor, but things didn't really pan out that way. And recently my mum got unwell and that she was diagnosed with dementia, and I've been taking care of her, and I really felt quite fulfilled from looking after people. And when this opportunity came along, I just thought it would be quite a good fit for me. South West Sydney Local Health District is pretty different from anywhere else that I've worked, and that I found that I've felt more supported in this role than I ever had with any other employee, and that they're really encouraging to further your education and that so you can move up the ladder. I've had a really good experience working at Campbelltown Hospital. The ward that I'm on has just been fantastic in that, like, all the staff there are very supportive, very encouraging, always giving me great feedback, and I just feel so supported, and it's almost like a little family. They just really take care of you, and it's an amazing place to work. This job's had a really good impact on me personally, and that because I feel that I've taken care of my health better and that I'm more active, I'm getting out there more. It's making me want to give up smoking, and that because the things that you see from the patients. Professionally, it's had a great impact on me. It's made me a lot more motivated, and I want to start doing my Bachelor of Nursing and that next year, and I actually want to get somewhere. Being an assistant in nursing's really helped me with wanting to further my career. This is a great starting point, and but I want to start doing my Bachelor of Nursing and that to become a registered nurse, and maybe even do my Masters in Nursing, and that to get the knowledge to be able to help Aboriginal people, and that because there's a massive gap in the health between white Australians and Aboriginals, and that especially in remote areas, and I would love to be able to work remotely. South West Sydney Local Health District is really encouraging to help with further education. They even provide study days. My nursing unit manager, and that she's very willing to work the roster around, and that when I go to uni, and that so I can still work and that and study at the same time, and it's just a very supportive environment. I normally start working at 7 o'clock and finish at 3:30, but once I've been here a little bit longer, that will change, and that there'll be rotating shifts and that, so you have morning, afternoon, night shifts. My average day is I come in at 7 o'clock. We do a handover with the registered nurses, which just involves going around to each patient, discussing their history, anything new that occurred overnight. Once the handover is complete, and that we start with things like getting patients showered that need showering, doing observations, so doing their blood pressures, their pulse rate, oxygen saturations, and then do some computer work, and that, like, we have to log all the observations that we've taken into the computer system, do weights of patients, and just give general care to patients, and that, like, if the buzzers go and they need anything, and that we're the ones that are there to provide what they need and help look after them so they can have the best recovery. On my ward, I feel very, very lucky. We have a really great team, and that there's a nursing unit manager who manages the whole ward, and she's absolutely fantastic, and that she's just very supportive of everyone. She's very involved with all the patients and with all the staff. And then we've got a CNE, the clinical nurse educator, and she's very supportive as well, in that she's the one that looks after our education, making sure that we have the proper training and encourages us to get further training and that, so we can improve our careers and move along to better positions. And then there's the registered nurses. They're very supportive in that they're the ones that do all the medication and that, and we're the ones that assist them in everything that they need. I really enjoy just looking after the patients and that, and especially when they're getting to the stage of being discharged and you know that they've come in very sick, and then they get to the point where they're feeling so much better and that, like they might have come in bedridden and then they'll be able to walk around and that, and to be able to see that improvement in someone it's really satisfying. Even though I love my role very much, there's some very challenging times, and that it's a very, very fast-paced industry. Sometimes you just don't get to sit down really, and that you're not sure when you're going to have lunch and that, because it depends on what the patient's needs are. If someone's there to kind of fill in for you so you can go and have lunch, and it's just very fast-paced, but it's also very enjoyable, the fast pace. I've had a lot of benefits since I started working at South West Sydney Local Health District. I'm getting a regular paycheck, which is absolutely fantastic. It helps a lot, but also I just feel supported, and I've never had that before really, and to be able to have that support, it makes me feel like I can accomplish things, and that's probably one of the biggest benefits that I've had since I've started working here. I think one of my biggest achievements of working at Campbelltown Hospital is I finally know what I want to do, and it's just such a big relief to be able to know what your future can be and the opportunity. And I want to do my Bachelor of Nursing to become a registered nurse. Being Aboriginal and working at Campbelltown Hospital, I feel it helps community in that, because they know me and that they feel a bit more comfortable coming in. And it's quite hard sometimes for Aboriginal people to come into hospitals and that, because there's a lot of negative things that have happened over the years and that, and if they feel that there's more Aboriginal staff there, they feel more comfortable, so they can get that help that they need. I think it's very important building relationships with the patients, and the way I do that is just communicate with them and that, talk to them, try to discover a little bit about their history and that, let them know a bit about my history, and just have a good old yarn. From the moment I first applied for the position, and that, I've had great support, and that especially from Tanya, the Aboriginal Workforce Manager. She told me that you can call her anytime. A lot of people say that, but you do and they won't even reply to you. Where Tanya, you can message her at 10 o'clock at night and she will reply to you. And to be able to have that support and you know that someone's there for you when you need them makes all the difference. To do my job as an assistant in nursing, you need to be a really compassionate person, and you need to be really caring. You also need to be pretty motivated, and that, to be able to get out of bed early in the mornings and stay back late sometimes. And it's very fast paced, so you've got to be willing to put in the hard yards, but the thing is, it's more than worth it. I think it's very important to have Aboriginal staff working at the hospitals, and that to be able to support our people. Because of a lot of the history and that, our people are kind of scared to go to hospitals and places like that, but if they know that there's a lot of our mob working there, they're going to feel a lot more comfortable and they're going to be able to get the help that they need. We really need more Aboriginal staff in health, because like, you might get an uncle or an auntie come in and they're being questioned and that about their date of birth and all these other questions and that, which can be so confusing. And some people are from the stolen generation, they don't even know their date of birth. And so if they're not going to say anything, and they might even just walk out the door. But if you've got an Aboriginal staff there, they understand that, and so they're going to be able to talk to them and be able to figure things out. There's nothing more satisfying than to be able to help the local Aboriginal community, And I even want to extend that and to be able to go and help the remote communities and other Aboriginal communities in Australia.